Hello everyone, I'm Dr. Syed Jafar, Assistant Professor, Department of Pharmacy Practice. Today we are going to discuss a topic called as Gouty Arthritis and the medication which are being most commonly used in the treatment of that disease conditions. So most commonly what happens is this disease is being undiagnosed, and that would be leading to a major problem associated with the individual person life. So when we are speaking about the gouty arthritis, we have to divide the things. One is ITIS is nothing but the inflammation. ARTH is associated with the bones or the joints we can consider. And gout is associated with the deposition of uric acids, or we can call it as the increase in the uric acid levels in our body. So normally we do have the range of the uric acids, that is 3.5 or 3.8 to 7.2 mg per deciliter. This is the normal range of the uric acid in our body, guys. So if at all the levels are being increased, then we consider the person is being suffering from the hyperuricemia, that is nothing but the increase in uric acid levels in the blood streams, and that would be leading to the conditions associated with the gout. So these are the two terms, guys, gout and the hyperuricemia. These are the synonyms, but they are being connected. But we cannot say that if at all a person is been suffering from gout, they would be suffering from hyperuricemia. It's not that. And if at all they have been suffering from hyperuricemia, they don't have to suffer from the symptoms of the gout. So these are the two synonyms. They are being interconnected, but they are being independent of each other. Now, when we are speaking about the gouty arthritis, we have to understand that it has been associated with the chronic inflammations of the joints and depositions of the urate crystals in the joints. And most commonly, this deposition of urate crystals should be occurring in the one joint that has been much more associated, what is called as the metatarsophalangeal joints. That is nothing but the great toe, and that is actually called as podagra deposition in that one. And what happens is whenever that depositions of the fluid, the urate crystals have been happening, the area, the podagra, the region or the toe would be getting swelled. They would be reddish in color, and the person would be suffering from a chronic pain associated with this one. So this is the chronic inflammation condition, guys. As I said, you the levels would be increased or decreased. That is been a different case, but here you will be able to see. And one more thing we need to understand about the gouty arthritis is they are associated with only one joint. That the reason we call it as the monoarticular joint involvement. Only one joint would be involved in the gouty arthritis. And if at all we are going for understanding this uric acid, what are the uric acid? Uric acid are the waste metabolites that are being formed due to the purine degradations, and also because of the cells cytotoxic, like it can be these cancerous cells or it can be the normal cells that are being causing. And also the diet would be associated with the production or the degradations of the purines. So what happens is in if at all you are taking the uric acid levels, the uric acid levels would be increased in our body because of the two things. One thing is being associated with increase in the levels, degradations of the purine, that would be leading to this problem. The second one is the under secretions of the uric acid. What do we need to understand with this one? If at all you are taking the animal, guys, the animals will be having an enzyme called as uricase, and that enzyme would be able to break down the uric acid into the simple form so that they would be getting excreted from our body, from the animals. But in human bodies or in the human beings, we lack the enzyme called as uricase. Because of that, what happens is the person would be totally dependent on the kidney to go for the excretion. So any person suffering from the kidney problems, or there is a decrease in the conditions, what happens is the uric acid levels would be starting deposited, and that would be causing the damage. And in normal things also, in the normal persons also, if at all the urate crystals are being formed, the uric acid levels are being increased, they would be getting obstructed in the we can call it as the ureters, and also they would be getting obstructed in the bladders, which may lead to the condition called as the renal failure. That is nothing but the post renal damage would be happening, that would be associated with the damage that would be causing the obstructions to the urine outflow, and also urolithiasis would be associated with. So if at all you are taking the gout person, this is the one of the scenario, guys, and you would be able to see the sudden onsets. That is nothing but the flares, we can call it as, the sudden onset of the pain and inflammation would be happening, or the person would be suffering from quiescent symptoms, that is no symptoms at all, the person would be living happily, the pain and inflammation is not been happening over here. And you would be able to see the tophaceous gout also, that means the excess deposition would be happening over here, and you would be able to see the crystals getting deposited that would be causing the damage. So, as I said you, the gouty arthritis would be happening because of two things. One is because of the overproduction, and the second one is the under secretions. So, overproduction will be only costing around 10 to 20%, guys. All the cases of the gout arthritis. The remaining 90% of the cases are being associated with, you need to understand about the under excretion of the uric acid from our body. That means the kidney is unable to remove the excess fluid associated. So the first thing, we'll understand how the production of the uric acid has been happening, and how the kidney would be playing a major role in the removal of the things. Then we'll understand about the medication that are most commonly used in the treatment of the gouty arthritis.